There is something seriously wrong when nurses have to take to the streets to beg for protection in the middle of a pandemic.
One of the problems that we're having now is the failure of the administration to recognize. The law says that the General Services Administration has a person who recognizes who the winner is, and then they have to have access to all the data and information that the government possesses to be prepared. We get to the point where we have a sense of when these vaccines comes out, how they'll be distributed, who'll be first in line, what the plan is. There are over 300 million Americans and beyond our border that are going to have to be taken care of. And there's a whole lot of things that we just don't have available to us, which unless it's made available soon, we're going to be behind by weeks or months being able to put together the whole initiative relating to the biggest promise we have, with two drug companies coming along and finding 95% effectiveness, efficiency in the vaccines, which is an enormous promise. So I just want to tell you that's the only slowdown right now that we have.
I myself have held the hand of dying patients who are crying out for their family that they can't see. I've taken care of co-workers as they fight for their lives on a ventilator, and knowing that they got sick because of the hospital or their government hasn't protected them. Throughout this pandemic, we've had to reuse N95s so many times. Sometimes the masks literally fall off our faces. In my hospital, we're still reusing N95s 2 times. But I know hospitals that they're still using them 8 to 10 times a shift, 8 to 10 shifts. We can't stay safe when we are using these kind of standards. We need to have optimal PPE for all staff to prevent airborne and droplet transmissions. We need testing of our workers and patients, and contact tracing and notification of exposure for healthcare workers. Do you know that I have not been tested yet, and I have been on the front lines in the ICU since February?
You're kidding me.
No. We also need safe staffing of nurses in the hospital units. And patients who are or may be COVID positive patients must be isolated from the general patient population. Workers who have been exposed or who are sick need to be allowed to quarantine at home without fear of losing income in their jobs. This is a novel virus, but the principles of infection control are not. Our hospitals have not been providing these basic protections. This is why it is so critical for the federal, state, and local governments to step in to ensure that nurses are protected. Unfortunately, the federal government has not been there. As a result, the pandemic is surging and frontline workers are getting sick and dying.